Hey guys, Dr. Darrington here. Wanted to spend a few minutes talking about pain and imaging studies. Today we're going to talk mostly about hip. One thing that I find a lot of times in my office, patients come in with an x-ray or with an MRI that shows a certain finding and they think that's got to be the reason for their pain. Unfortunately, it's not always that easy. There's actually a study that came out a few years ago looking at patients with hip arthritis and with hip pain and found that only 15%, 15% of patients who had hip pain actually had imaging studies showing arthritis. And the opposite of that, patients that had arthritis, only 20% of them had frequent hip pain. So this is a very kind of eye-opening study for most people, something that doesn't surprise me very much because I see this all the time. I've had, unfortunately, too many patients come into my office that had a hip replacement surgery and it didn't change their pain at all. And when I start examining them, start asking them questions, turns out their pain wasn't coming from the hip at all. It was coming from tendons on the side of the hip, maybe from their low back, and it was misdiagnosed as causing or as being related to their hip arthritis. So kind of a couple things to really make sure that you're keeping or that you get evaluated well is one, having appropriate questions being asked, as well as having a really good thorough evaluation. And that person needs to be able to evaluate not only your hip, but also, well, not only hip joint, but also tendons on the side of the hip, which are usually visualized well with ultrasound. You need to be able to evaluate their low back, and need to be able to think about multiple things that could cause pain, because pain here in the front of your hip can be caused from something completely different than on the side of the hip, than in the glutes or in the low back, that people oftentimes will call this whole area being hip, but multiple different structures, multiple different areas that could actually leading to the symptoms. So definitely be cautious before you do something invasive. When you think that you've got the answers because you got an x-ray or an MRI that showed a certain finding. The fortunate thing, like I talked about last week, a lot of patients who have hip arthritis is actually causing hip pain. We can oftentimes help. The gentleman last week we talked about had both of his hips, really advanced arthritis for a young patient. Got back to a lot of the activities he's been struggling with for years, and has been able to avoid having that hip replacement surgery. I've got a number of patients like that. I think that looking at your options, making sure you, one, get the right diagnosis, and two, look at the choices that you have short of doing a hip replacement surgery, which is essentially an amputation of the hip joint, which unfortunately doesn't always take care of the pain. So if you or someone you know is having pain in their hip, go make sure you go to someone that can help figure it out if it is actually coming from the hip joint or somewhere else in that hip region, and can talk through multiple different ways to potentially treat that, hopefully avoiding steroids and avoiding invasive surgeries. So that's it. We'll talk to you guys soon.